Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Welcome to this special edition of Heart Talk. I'm Denise Busman, one of the vice presidents with MedAxiom in the Care Transformation Department. And with me today is Jenny Kennedy, another one of our vice presidents for Care Transformation with MedAxiom. Also joining us are our guests today, Rod Roeser and Sarah Shelton with HVC in North Atlanta. They've recently implemented Pritikin Intensive Cardiac Rehab, and they're here to tell us a little bit about how it all got implemented. So Rod, if you would just kick us off, tell us a little bit about how you arrived at Pritikin. Well, maybe tell us a little bit about your practice first, and then how you arrived at Pritikin.
Sure. Well, our practice, Heart and Vascular Care, it was founded in 2007 with 2 physicians, and today we sit with 22 physicians and 18 APPs, and we see patients in 12 different locations around North Georgia and going all the way up to the border with Tennessee and North Carolina. We've got a variety of service lines, and we are always looking for ways that we can increase the amount of services that we're able to provide to our patients within the 4 walls of our practice. Mm-hmm. And one of the things that we heard repetitively from our physicians is the amount of time it took them to get a patient into traditional cardiac rehab at some of the places where we referred. Mm-hmm. And frequently it was a long time from the event that the patient had until they were actually able to get in. And that led us down this path of investigating an intensive cardiac rehab program for ourselves.
Oh, interesting.
Yeah, that is interesting. So curious on who was responsible for making that decision and what made you choose intensive cardiac rehab as opposed to the traditional model, given the access issues, but that's still a decision point. How did you guys decide on this model?
Well, I think the idea started with a physician administrator dyad, and there were 3 of us that were really thinking about it most, and then we presented the idea to our board of directors, which is a group of 7 physicians in our practice. And then we actually met Pritikin at a partner pulse here at MedAxiom, and that's how we started down the journey with Pritikin. And they really led us through the process from beginning to end, from the initial stages of developing the pro forma to make sure that it would be financially feasible for us to do it as a private practice, all the way to when Sarah picked up and really did all the hard implementation work.
Yeah, well, that's a good point. Implementation, I think that's what's kind of scary to people. It's like, holy cow, how are we possibly going to do that? So tell us a little bit about what that implementation timeline looked like and how you really went about it.
Well, we started the process in 2022. We were building a new facility, a new office for a physician who was joining us, and we were able to carve out about 2,000 square feet of space so that we could have a spot for the rehab program. And so that was in 2022 when we first started planning. And then that's when we met Pritikin and worked on the pro forma. And then in 2023 is when Sarah joined, and that's when we really had our kickoff call in the spring of 2023, and then we got into the very detailed planning in the late spring, early summer of 2023. And you might want to talk a little bit about the staffing and.
Yeah, absolutely. So in about late July, early August of 2023 is really when we started to bring staff on, and we had a lot of internal movement within the company. A lot of times stress test technicians get overlooked, but there's our exercise physiologists looking to break through into cardiac rehab. So from the get-go, we had staff internally that were passionate about starting this program. Yeah. Come early to mid-August of 2023 is when our staff really started to do remote training with Pritikin. And those were live classes on a weekly basis that taught our staff how to do operations and compliance, how to optimize patient engagement. All of Pritikin's 3 pillars and workshop topics were taught to us, learning the resources and the materials that Pritikin was going to give us. That was also around the time where we started to learn Pritikin's core videos. And then come, early September of 2023, we had that whole month to really practice. Pritikin came on site And that was our opportunity to really teach back what we had learned in August. The workshops and do mock sessions, mock intake sessions. And Pritikin, again, held our hand through that whole entire process. They taught us how to do the Pritikin portal. And that's our database that we put all of our patient entries into. And they were nice enough to stay when we went live in September, around September 18th of 2023. And they watched us do our first intakes and made sure our messaging was consistent, make sure there were no obstacles and barriers, so that by the time we went live with our exercise and education sessions, it was pretty easy.
Yeah, that's great, yeah.
So did I hear you correct? So you started like actual implementation and planning in April of 23 and go live was September of 2023.
It was.
That's pretty
Wow.
accelerated for a lot of organizations, especially considering the things that you had to set up. So with that support that Pritikin offered your team, were there still any areas that the physicians or the team members are like, I'm not really sure I'm bought into this? And then what kind of things did you do that or notice that helped kind of ease that burden on your team as you were going into go live?
I mean, we had the physician and staff support kind of from the get-go, like Rod was saying, getting these patients in pretty quickly. Physicians were on board with that, and then the staff just being so excited to get started. Of course, you have some nerves starting any program of the environment, how it's going to turn out, the launch, especially taking stress tests. Technicians who are used to one patient an hour to maybe having 8 in a gym setting. So you definitely had a little bit of hesitancy there, but all in the name of being excited about this.
Yeah.
So in terms of physician and staff support from the get-go, we've been so lucky to have that.
That's great. And I think another, just to piggybacking, one of the things we hear about commonly that's a challenge is the cooking demos, the cooking classes. That feels like a really big barrier for a lot of programs, and they don't quite know how to navigate that. So how did you guys implement the cooking demos into your program?
Yeah, so the cooking demos, when we started, we didn't have a registered dietitian. So Pritikin has an aspect called Pritikin Live where they offer us registered dietitians who do that portion, and that makes it really easy for us. So again, they've been very flexible. That's been the main term used, especially with Pritikin, that they're flexible with your facility schedule and helping you get started, especially with something like the cooking school. Patients who come in that are a little hesitant about doing something with dietary changes, Pritikin makes them comfortable. We have the patient guidebooks with all of the recipes. I think patients find that it's not scary to make these changes. The recipes are simple. It's not just doing it on site. They're able to put this into practice when they get home. The registered dietitians have been lovely in terms of building that relationship with our patients and that trust and answering any questions they might have. So, again, a little bit of hesitancy even from patients, especially with cooking school and nutritional changes, but Pritikin makes it pretty simple.
Yeah. Oh, that's great. Now, implementation sounds like it was fairly compressed, got started right away and things like that. Did you run into any bumps along the way, things that you had to modify, make changes, or what do you think it was that helped you to have the rollout that you did?
Well, I think probably the only challenge that we experienced was with the revenue cycle piece of it.
Okay.
Yeah, so we found out that you need a separate MPI number, you need a subpart PTAN. So there are some steps you have to go through with Pritikin. Pritikin gives you a certificate that allows you to be certified to do ICR. And so with that certificate, then you have steps you have to take with Medicare.
Okay, yeah.
So probably the revenue cycle was the piece that we had to learn along the way.
Were there any implementation with patients, Sarah, that were like you thought you'd do it one way and then you found a better way to do it, or there lessons learned there?
Always lessons learned along the way, making schedule adjustments, expanding where we need to so that patients have more opportunities to come in than what we initially had. Even if it's taking 2 full intake days, Mondays and Thursdays, and cutting that in half, but doubling the hours so that we're bringing in the same amount of patients, but offering more exercise and education classes. So I find that, even in our sophomore year, we're going to continue to make these adjustments.
Yeah.
Given the extended times, right, so it's double what traditional is, and patients come in and they exercise and then they have education. I think there's a lot of concern out there that patients are not compliant with traditional. How are we going to expect to double their time and ensure they're compliant? Have you had any concerns with that, or are your patients staying engaged with that time that is needed?
Yeah, so when we say it goes from 36 to 72 sessions, the timeline remains the same. This is completed within 12 to 18 weeks per insurance, so none of that is different. It's not 45 to 60-minute sessions anymore. We do ask for about 90, so in that sense, you know, a little bit more commitment when the patient comes in, but they're taking away a lot more. It's not just the exercise, it's all the education. We emphasize the peer support. So a lot of what they're learning, they are taking at home. They are excited to see their peers. It keeps them engaged. With the cooking school, we offer Costco-sized samples of all the recipes. Makes it a little bit more interactive than just watching the screen with the registered dietitian. So based off your facility, you know, you want to find ways to keep it entertaining but still meeting those medical goals, but making it fun for the patients because it is a commitment and they are coming in 2-3 days a week.
Yeah. Well, so that's interesting. Now, Rod, you're kind of the guy who has to take the heat to make sure things work. So what have you found, I mean, in terms of financial and operational success? Is that something you say like, yeah, we hit a home run, or it's like, oh, okay, it was pretty good?
It certainly exceeded our expectations. We thought we did some pretty careful planning, but our number of billable sessions per month has exceeded where we thought we would be. And I think a lot of that is because our providers are really, they're happy with the program because they can get people in timely, and there's a lot of feedback. Sarah spends a lot of time with feedback to the providers about their patients and about their care, and so I think that's really helped to grow the program.
Nice. Good to hear.
So I have a question. If I came to you and said I've been tasked with putting ICR into place in my organization, I'd love to hear from each of you kind of what your one piece of advice would be for someone starting out on this journey.
Well, I think for me, I would work really closely with Pritikin on the pro forma, and I would be conservative in terms of space and scale. Yeah, I don't think you want to overbuild the program when you're first starting, because you can always add to it later. But just to make sure the numbers work and it's feasible, I would start on the conservative side.
And really just having the right staff in place. You know, physiologists, again, are excited to break through into cardiac rehab. There are subset specialties. A lot of my physiologists have backgrounds in medical nutrition or nutritional functional practitioners who come into this. So really expanding that scope of practice and wanting to be passionate not only about the exercise portion, but about the dietary and nutrition changes.
So where do I find those enthusiasts? Are they in hospitals? Are they in offices? Where do you find those?
They're everywhere. And I find that, you know, a lot of college students coming out, you know, they're ready, they're hungry, they want to break into it. Everything's fresh on their minds, but really they're kind of everywhere.
Great.
That's
maybe in your company already. So
yeah, there you go. That's terrific. Well, and it sounds like you've had really great patient outcomes too. And have you stayed? It sounds like it took off pretty quickly, and you stayed busy. So tell us just a little bit about the outcomes you've seen with patients and how that's helped to grow the program too.
Yeah, outcomes with patients, they show in all sorts of ways. You have your physiological or, you know, the fitness testing aspect, which is we perform the 2-minute step test, and we perform that at intake, and we do it every 28 days for their ITP reassessments, as well as discharge or graduation. So with that, you know, if a patient comes in on their intake day, they might only do 90 steps, and by the time they're done, they're doing over 200. Some, you know, have to do a modified version where they're sitting down, and to see them doing that standing up, that's what we're looking for. We see their EF percentages increase. We see their PHQ-9 mental health scores go down. Obviously, when they come into the program, they're frustrated, discouraged, scared, understandable. So having that peer support, having the ICR staff, building those relationships, I think helps them. Being connected with their cardiologist's office. And then, of course, the rate your plate with the diet and the nutrition. Sometimes their scores are low starting off. They don't know any better. Pritikin really gives them those resources and materials to score a bit better by the end. And then, of course, you have self-reported outcomes. Patients who start the program and they can't walk their dog up a hill because they get short of breath. You want to listen to that feedback. You know, on month 2, they're so excited. They're doing 5+ miles. They went up that hill. They're no longer short of breath. I have patients that come in with black bean brownies that they would have never considered at the beginning. So you look for those, and I think that just seeing them put that into practice, we enjoy those outcomes.
Oh, that's fantastic.
That is fantastic.
Well, this has been a great conversation. Thank you so much, Rod and Sarah, for joining us today. I'm Denise Busman, and with Jenny Kennedy on the MedAxiom side. Thanks for joining us for Heart Talk.